Hi, Dr. Alex Perry here from the Perry Centre. Thanks for joining me today. If you're watching this video, then there's a very good chance that you're pregnant and perhaps you're getting really close to birth itself. So this video is really about birth and beyond. If you're pregnant and you're struggling with some things like morning sickness or breech babies, I just encourage you to watch the video prior to this, which is all about treatment in pregnancy. But if you're getting close to birth, I want to talk to you a little bit about the natural induction of labour. Now, this is really only relevant if you are staring down the barrel of a medical induction. And now that may be because you've got some other underlying condition, perhaps gestational diabetes, or perhaps your pregnancy's from an IVF round. But there's some reason that medically they want to induce you early, maybe around 38 weeks or thereabouts. So this is an opportunity for you to consider trying to get into labour naturally before you get to the point of a medical induction. Or perhaps you're overdue already. Perhaps you're 40 weeks or just over 40 weeks, and your obstetrician or perhaps your midwife or the hospital is already talking about a medical induction. And really, if you would prefer to have, or prefer to try anyway, to have a natural labour, then this is for you. Now, acupuncture has been for millennia used throughout pregnancy and certainly to help women get into labour itself. Now, I think there's a bit of a misconception about labour, that it's a little bit like, starting at the top of a hill and kind of rolling down. Getting into labour is actually reasonably hard work. It's more like climbing a ladder before you can go over the edge. So my suggestion is always that we have a little bit of preparation time, some lead up time, an opportunity to get your body ready for labour and to prep it so that you're ready to go. So if you find yourself staring down the barrel, as I said, of a medical induction, and you'd like some help to try and get into labour naturally, then I'd love you to give me a call and we can talk through your options. Now, if you'd really like to have a natural birth and you've got some time, perhaps you've had children already, or perhaps this is your first baby, it doesn't matter. Some preparation is really important. Now, the best place to start in terms of preparing for a natural labour, from my perspective, an acupuncture perspective, is from 37 weeks. Now, the reason 37 weeks is important is because at 37 weeks, you are considered full term. Your baby is ready to go medically at 37 weeks. Now, there's some talk that it's a little bit earlier than that these days, but I think 37 weeks is pretty safe. So I don't certainly like to start any form of natural induction or preparation for labour until that 37-week mark, unless there's a really good reason to do so. And at 37 weeks, we're really just trying to encourage your body to do what it's going to do anyway, to do what it's going to do naturally. The way that I kind of look at it, it's a bit of a funny way of viewing labour, but this is my analogy. It's a bit blokey. Bear with me if that's okay. For me, and bear in mind that I'm a bloke telling you what going to labour is going to be like. I haven't done it myself, obviously, but I've certainly walked along many women alongside them who have been through labour. So labour is a little bit like, I imagine if I was going to go down to the public pool and I wanted to dive off the 10-metre platform, there's a few things I've got to do first. I've got to drive to the pool, of course. I've got to be in the change room. I've got to cross the pool deck. I've got to climb the ladder out onto the platform before I've got any chance of going over the edge. Labour, in a sense, is a little bit like that. You've got to be, your body and your baby, you've got to be on the top of the platform, a little bit with your toes dangling over the edge in order for you to go into labour. So the way that I sort of visualise what acupuncture does is it just encourages your body to take those steps. So rather than getting changed and then stepping out of the change room but staying on the pool deck, acupuncture encourages you to keep taking those steps. And if you're on the ladder and you're climbing, rather than sitting, on 2 or 3 rungs from the bottom, acupuncture will help to walk you up or climb you up out along that ladder in the analogy to try and get you closer to moving into labour. Now, this is really important, especially if it's your first baby, because anecdotally, we know that a lot of first pregnancies go a little bit longer than usual. So if you can do something to try and move things forward just in a very gentle and safe way, a very practical way, then I think that's really useful. And I've seen many women, not just from a fertility perspective and then a pregnancy perspective, but also from a getting into labour perspective. And so it's a real pleasure for me to walk with women during their pregnancy and to help them have a natural childbirth if that's what they desire. Now, of course, going through this process doesn't guarantee anything other than that we're going to do our best to move you through that process, get your body and your baby as close as we can to being ready to go into labour. But I have to say, for the majority of women who go through this process with me in this clinic, I can only talk about my own experience, my own patients. The majority of those women go into labour and have their babies, regardless of whether they've got gestational diabetes, whether they've been through IVF, or whether it's their first pregnancy and they're already a little bit overdue, or perhaps they've had a medical induction before, perhaps even a cesarean section before, and they really just want to have a crack at a natural birth. Then in all of those cases, we can help to move you closer to that point. I can't promise you that you're going to go into labour on your own or have the natural birth that you desire, but it certainly is a practical step that you can take to try and nudge you in that direction. As I said, based on the numbers in my clinic, the women that I see, the majority of those do go into labour and have their babies naturally. And I have to say too that some research that came out a few years back now out of New Zealand that showed, or at least suggested, that women who went through a kind of a routine pre-birth acupuncture from that 37-week mark do tend to have better labours, shorter labours, less intervention, therefore quicker recovery for both mum and bub, which is really important. So if you're looking for a natural birth, then you could consider either birth preparation or natural induction using acupuncture. And if you're worried about any aspect of that, don't let your worry or your anxiety or perhaps some preconceived notion of what acupuncture is, don't let that stop you from at least reaching out and asking a question. Okay, and perhaps by asking a question, you can have some of those fears and anxieties allayed, and then you can make a decision based on information, not just on hearsay. So if you're looking for a natural labour, perhaps I can try and help. If you're looking to try and avoid a medical induction, perhaps I can help. Congratulations on having your baby. Now that you've had your baby, whether it's your first child or subsequent children, perhaps you're trying and maybe having some difficulty with breastfeeding. And there's a couple of breastfeeding issues that are worth talking about, and which I've got a lot of experience in. I'm no good to you at all in terms of lactation consultant type work, attachment issues, the kind of the physical process of getting your baby to attach. That's not for me, but I'm more than happy to refer you to a lactation consultant. But where I can help is perhaps if you've got a supply issue, a milk supply issue, and it's not uncommon to not have enough milk. So if you've got a supply issue, not enough milk, then that's something that's certainly worth a conversation about. The other breastfeeding issue that I can perhaps help with is mastitis, and a lot of women do get blocked ducts or poor flow, and sometimes that leads to lumpy breasts or poor milk flow, perhaps even redness, perhaps even infection. Now, if you're at the point of infection, you probably should go back to your GP and consider some antibiotics if that's appropriate. But if you've got a blockage or pain or lumpiness or even some mild redness, you might consider acupuncture. In my experience, acupuncture is actually really good at encouraging better flow. It's one of the things that acupuncture does, almost as a byproduct of the process itself, is an increased flow to the area. Now, flow of what? Well, it could be blood flow, it could be milk flow, it could be just getting things moving, particularly when they're stuck, which is exactly what mastitis is. It's an inflammation of the ducts that allow the milk to flow out, either because they're blocked or because there's an infection or something similar. So if you're struggling with mastitis, it's certainly worth a conversation, particularly if you would like to try a natural approach first, and have had, again, within the clinic, within the patients that I see, great and positive impact on women who are struggling with both a milk supply issue and also from mastitis. You know, you've just had your baby, and you know, it should be a great time, shouldn't it? But you know, I've got 3 children. I know what it's like. It's not always easy when you've got a new baby at home. And I think that it's really important to make sure that you keep your own well-being looked after, because it's while you're still pregnant, the focus is on you as the mother, the pregnant woman, right? But once that baby is out, then the focus goes almost entirely onto the baby, which is certainly appropriate. The baby needs all the support and the love and the help and the nurturing that it gets. But you as the mother have just been through one of the most significant things in your life. You've had a baby, whether it's naturally or whether it's a cesarean, and your body needs time to recover, and all the focus has gone now onto the baby. So let me just bring the focus back onto you for a minute, and let's think about your well-being. So if you're struggling, it's not necessary to do it on your own. It's important to have a support network around you. And that could be family, of course. It could be your GP. Perhaps you've got a lactation consultant. But you could consider talking to me about well-being. And that could be helping with stress, not sleeping well. Now, not sleeping well, in brackets, yeah, you've got a new baby, I get that. But perhaps when the baby's asleep, you're also not sleeping well for whatever reason. So don't allow your kind of those first few weeks or months when you've got a new baby to be all-consuming and detrimental to your own well-being. Sometimes it's worth even just having a conversation, and perhaps we can talk about how can we help get you to a point where you're starting to feel strong and back to, you know, starting that recovery process for yourself, because you've done one of the perhaps the most incredible thing you can do as a woman is to have a baby, to start or to grow your family. But now it's time to also go, let's look after the baby, but let's make sure you, as the mother, are also having your well-being taken care of. So if you've got a baby that needs to come out and you want some help, if you already had your baby and you're struggling with some issues of breastfeeding, particularly not enough milk supply, or perhaps mastitis, or you're struggling just with general well-being. Maybe you've got headaches or pain or stress or not, whatever, insomnia or whatever it is that you are experiencing after you've had your baby. These things are worth a conversation about. And I'd like to invite you to do that. It's my great privilege and pleasure to serve you and your family. So if you'd like my help, or even to talk something through, or get a second opinion, I'm more than happy to speak to you. You can get me on the phone on 61624950, or you can contact me through the website. You can also book in directly. There's a button on the right-hand top part of this website, and you can book in directly. So I just encourage you, if you'd like to do that, please take me up. But of course, you're welcome to chat with me on the phone for 10 minutes, and we can work out whether what I have is a good match for where you're at. And if that's a good idea, if that seems good to you, then let's make an appointment. Anyway, congratulations on having your baby, or getting ready to have your baby. And if I can help, please let me know. My name is Alex Perry, here at the Perry Centre, Canberra's Natural Fertility and Women's Health Clinic. We've been doing this since 2006. What a pleasure and a privilege it is to serve my own community. I love children and families. It's what I'm passionate about. So if I can help, I would really love that opportunity. Until I hopefully see you in the clinic. Bye for now. Well, thank you so much for watching through to the end of the video. I hope that you found what you're looking for, whatever you're struggling with. I'm hoping, from a women's health perspective anyway, I've given you some answers or some ideas of how we go about treating some very particular conditions here at the Perry Centre. If you're ready to make the next step, I've made it really easy. It's just a matter of hitting the big button directly below this video. It'll take you to the booking page, and really look forward to meeting you really soon.